think a major problem is the severe underfunding of, underinvestment into the care workforce.
Right now there is a political, I think, will from the general public, so to speak, to support that kind of investment that has been wanting in this sector for a long time.
And I have seen many individuals, care workers and managers who've worked in the sector for 5, 10, 15 years saying, I just have to leave. I'm going to another sector. I can't cope anymore.
The COVID-19 pandemic has exposed the frailties of the social care sector in the UK. Lockdowns, self-isolations, and precarious working conditions have left care workers in more vulnerable positions in the workplace than ever before. A study with 1,800 care workers over the course of 2 COVID-19 waves in 2021 has been conducted as part of the Retention and Sustainability of Social Care Workforce, or RESSCW study. The study has shown a light on the worrying working conditions that care workers face. Abuse, pay, and staff well-being are 3 concerning themes that have been highlighted through the research carried out, and it's having a massive impact on retaining staff in the UK. Over a quarter of the 1,800 participants had suffered some form of abuse during the 2 COVID-19 waves in 2021. 20% of them reported verbal abuse, with 11% claiming that they had been bullied, a further 7% receiving threats, and 4% suffering from physical abuse from people using the services, their informal carers, co-workers, and the public.
I think the pressure which the residential care sector was subject in terms of the ban on visits to users, I think this had a lot to do with the type of abusive behavior that care staff experience. I think it also had a lot to do with the profile of people we have in residential care homes, many of which have dementia and other cognitive conditions, which of course whose symptoms were heightened by the whole context of the pandemic. And I think this was also something that we didn't pay sufficient attention to, so there was, rightly so, concerns around the mortality, but not so much about maintaining the well-being of people who were residing in care homes.
On seeing the results, I think the most worrying thing is how much abuse care workers experienced during COVID, when they were doing very difficult jobs, really sacrificing their health, their family time to support people. And unfortunately, in return, society was responding with abuse, including verbal, but also physical. So I think as a society, we really do have to have a good look at ourselves and discuss why on earth would we ever attack people who are doing such important work in such difficult times.
Another alarming statistic that has surfaced from the study shows that workers from Black, Asian, and minority ethnic backgrounds, as well as workers from different nationalities, suffered a higher proportion of abuse during the pandemic. White British care workers reported experiencing abuse at a rate of 24%, while 29% of white non-British workers reported the same. When it comes to workers from Black, Asian, and minority ethnic backgrounds, 40% reported some form of abuse in the workplace. That's almost half of the Black, Asian, and minority ethnic participants in the study.
Country of origin, when it comes to migrants, is really important and necessary to consider when we're looking at the experience of care workers. We found that care workers migrating from outside of Europe faced significantly worse working conditions and were treated worse in comparison to, for example, their European migrant counterparts. So this really underscores, based on the findings we learned today and our own work, that both in research and in policy making, it's really necessary to consider the nuances in care workers' experiences.
The findings, secondly, I think it's very worrying that people from Black and minority ethnic backgrounds experience more abuse than others. I think it still shows some racist approaches in how people perceive things, who they point fingers and blame. And that needs to be really addressed very quickly, both within organizations and on a wider scale.
Shockingly, less than half of the care workers who suffered verbal abuse reported their experience to a manager or supervisor. Even more concerning, 26% claimed they took no action at all. These staggering numbers reveal not only a broken system, but also a system that leaves care workers feeling vulnerable. These figures have come at a cost, with care workers' mental and physical well-being taking a hit. Much of the media attention during the pandemic was rightfully focused on the well-being of people using the services. However, care workers' suffering were not visible to the public.
Training workers in the field of long-term care is very important because turnover has disastrous effects on both the efficient running of the home, but also on the psychosocial well-being of older persons.
I certainly think that care managers can be receptive and open to conversation and dialogue with care workers. So when care workers come to them with concerns or to report incidents, certainly listening and actually following through on actions to address the problem, I think is a big way in which care workers can feel supported and they can feel like their voices are being heard.
The study also uncovered the demand for care staff to work longer hours during the pandemic. It has left them tired, anxious, and exhausted. It highlighted the lack of additional pay for their sacrifices. 32% of participants claiming they received no additional pay despite an increased workload.
The Care Workers Charity is a benevolent fund for care workers. We support care workers financially through crisis grants. At the moment, obviously, with the cost of living crisis, people are experiencing a lot of difficulties covering just the basic needs that their families have. We at the charity, since March 2020, had to pay out £2.8 million to care workers to support their loss of earnings because of COVID absence. And we definitely didn't get to everybody who wasn't paid. So you can only imagine how many more care workers are there who lost income, potentially got into debt and seriously bad financial situation because they were working in the pandemic, supporting people during COVID, contracting COVID themselves, and then having to take time off work without full sick pay. Because what needs to be ensured is that every worker in social care sector, if another pandemic ever comes, gets full pay.
To address the issue that we need to have beneficial financial packages, but also beneficial psychosocial attention or services to these workers. So I think one possible action, precisely your project, is to improve the quality of life of persons working in long-term care in order for them to feel adjusted, to feel well, to feel part of the system rather than as an adjunct to the system.
And the latest figures from Skills for Care suggest that the care work sector in the UK is suffering. Official figures suggest that 2021 was one of the worst for the sector in 10 years. The workforce has shrunk with over 165,000 vacant positions available. The challenge for policymakers and provider now is to ensure recruiting and retaining staff through more support, better pay, and a system that protects our care workforce.
Investing in research, investing in efforts to recruit and retain. I think a major problem is the severe underfunding into the care workforce. I think this has been a chronic problem in many countries and for quite a while. So if anything, I think, it's driving the message to policymakers that more money is needed to invest in this area. We're not going to see any changes in recruitment and retainment unless money is funded and unless it's recognized that this is a priority.
I will mention another word, support. I think there should be emphasis on the employers, the providers, the stakeholders who are responsible to support the workers working in long-term care, support their social well-being and psychological well-being.
Low-cost sort of model of care has its limits. It's really not working. So improving the working conditions improving also the qualifications needed, improving the pay, but also related social benefits like sickness payment and access to those payments. I think that's something that needs to be done, that can be done in a relatively short term. And I would also say that right now there is a political, I think, will from the general public, so to speak, to support that kind of investment that has been wanting in this sector for a long time.
We need a national professional body for care workers to give them a sense of belonging, because that is a big issue, and I believe that really contributes to levels of turnover and lack of retention in the sector, because people, with your examples of abuse from the research, people feel they have nowhere to go. And where we actually think of care workers at the same level as we think of healthcare workers in terms of respect, recognition, but just at this level of, you are very important.